You've probably experienced standing at the bottom of a flight of stairs, looking up and feeling like each step is a challenge, something that used to be easy to get through, but now leaves you feeling tired and sometimes anxious. So what's happening to your feet? If you're entering your golden years, you may find that moving around, especially walking, is becoming more difficult than ever. And you're not alone. After the age of 50, many people begin to experience a decline in strength and mobility in their feet. But don't worry, this isn't something that can't be reversed. There are simple and effective strategies you can use today to improve your condition. In this video, we explore why your legs are getting weak, and more importantly, what you can do to restore the strength in your legs so you can continue living independently and confidently. Imagine you are a 65-year-old who wakes up every day with small goals, like walking to the store, climbing those stairs that you once considered easy. But then, one day, you realize that walking is no longer easy. Your legs start to hurt, and every step makes you feel anxious about losing control. You think it's part of getting older, something that can't be avoided. But one morning, while looking out the window, you see an old friend. She is also in her 70s, but she still seems to be able to walk as briskly as when she was younger. She shares with you a simple secret that has helped her maintain strong legs all these years. Her story will surprise you, and you will decide to try to make some changes in your daily routine. Today, we will explore the main reasons why your legs become weak after 50 and how you can change that. Together, we will find solutions to maintain leg strength and continue to live a healthy and active life even as you age. Let's get started. Did you know that as early as your 30s, your muscles start to lose some of their strength, and after 50, this becomes more evident than ever? Sarcopenia, or age-related muscle loss, can be the main reason why your legs are gradually weakening without you even realizing it. Sarcopenia is a natural yet dangerous process that causes our muscles to decrease in both quantity and quality. This process becomes more pronounced as we enter our 50s, affecting not only our strength, but also our mobility. Muscles begin to weaken, reducing our ability to move and increasing our risk of falling. This can make you feel slower and even tired when doing everyday tasks, such as climbing stairs or hiking. And although sarcopenia is part of the aging process, it is not irreversible. To understand it better, imagine your body as a car. If you do not maintain it properly, the machinery will gradually break down, and one day the car will not be able to operate as before. The same is true of our bodies. If we do not maintain a reasonable exercise and diet, our muscles will weaken, reducing our ability to move, maintain balance, and perform basic activities in life. Consider the story of John, 68, who suffered from muscle weakness after years of inactivity. At first, he didn't realize he had a problem, but when he climbed stairs or took long walks, he felt tired quickly and could feel the weakness in his legs. When he went to see a doctor, he was diagnosed with sarcopenia. However, the doctor recommended that he do resistance exercises and add protein to his diet. After a few months of perseverance, he saw significant improvement. He could walk longer, climb stairs without getting tired, and felt more confident in his daily activities. A common mistake that many people make is thinking that sarcopenia is inevitable and that nothing needs to be done. However, if you don't maintain a regular exercise routine and a protein-rich diet, you will make the condition worse. Additionally, many people think that exercise is only for young people. However, maintaining muscle strength through exercises such as resistance training is important for all ages, especially for older adults. So, how can you prevent sarcopenia and maintain leg strength? Resistance exercise. This is one of the most effective ways to maintain muscle and strength. Simple exercises like squats, lunges, or using resistance bands can help you strengthen your legs. High-protein diet. The body needs protein to build and repair muscle. Adding protein sources like lean meats, eggs, dairy, and plant foods like beans, nuts, and legumes can help maintain muscle. Stay consistent. It is important to maintain your exercise routine and diet even if you don't see immediate results. Remember that muscle recovery and maintenance is a long-term journey. Sarcopenia is not an inevitable part of aging. With simple habits and strategies like resistance exercise and healthy eating, you can prevent muscle weakness and maintain the flexibility and strength in your legs, helping you continue to live a healthy and independent life. Now that we understand one important part of maintaining leg strength, sarcopenia, let's explore another equally important factor: peripheral neuropathy, a condition that many older adults face, causing them to feel weaker and less in control of their legs. Have you ever felt numbness, tingling, or even sharp pain in your legs when you move? These sensations may not just be a sign of normal fatigue, but a symptom of a more serious problem: peripheral neuropathy, also known as peripheral nerve damage. Peripheral neuropathy occurs when the peripheral nerves, the nerves responsible for transmitting signals from the brain and spinal cord to other parts of the body, especially the legs, are damaged. This causes numbness, pain, or weakness in the legs. Although anyone can develop the condition, it is especially common in older adults, and especially in people with diabetes. When the nerves are damaged, the brain and body cannot communicate effectively, leading to symptoms such as numbness, loss of feeling, pain, or even muscle weakness. This can make walking more difficult and can even cause you to lose your balance and increase your risk of falling. Don't ignore mild symptoms. This condition can become more serious if not properly managed. Peripheral neuropathy not only affects the sensation in the legs, but also impairs mobility and affects quality of life. It is important to realize that although nerve damage cannot be completely reversed, if detected and treated early, we can reduce its impact and maintain independence in our daily activities. Consider the story of Linda, 72, who has lived with diabetes for 20 years. She began to experience numbness and pain in her legs when walking, which worried her. When she went to see her doctor, she was diagnosed with diabetic neuropathy, a form of nerve damage common in people with diabetes. After changing her diet, controlling her blood sugar more closely, and using some nerve pain medication, Linda felt much better. Although her condition was not completely cured, thanks to the right treatments, she was able to continue to participate in activities such as going for walks and even playing with her grandchildren without feeling pain or worrying about losing her balance. One of the biggest mistakes many people make is ignoring the early symptoms of nerve damage, such as numbness or tingling, thinking they are not serious. This can lead to the progression of the disease and make treatment more difficult. In addition, some people also neglect to control underlying conditions such as diabetes, a common cause of nerve damage. So how can you cope with peripheral neuropathy and maintain mobility? Controlling the underlying condition. For people with diabetes, controlling blood sugar levels is of the utmost importance. Make sure you maintain a healthy diet, get regular checkups, and follow your doctor's treatment plan. Supplement vitamin B12. Vitamin B12 deficiency can lead to nerve damage, so supplementing this vitamin through food or supplements can help prevent further nerve damage. Treating nerve pain. Pain medications such as gabapentin or pregabalin can help relieve symptoms of numbness and pain. Consult your doctor for appropriate treatment. Exercise. Even though the nerves are damaged, it is still important to stay physically active. Gentle exercises such as walking or yoga can help improve flexibility, maintain muscle strength, and improve balance. Peripheral neuropathy is not a condition that you have to accept as an inevitable part of aging. With the right care and timely treatment, you can minimize symptoms and maintain mobility and balance. It is important to always listen to your body and seek medical help when necessary. We have just learned about the effects of peripheral neuropathy and how to treat it. Next, let's explore another cause of leg weakness: peripheral artery disease, PAD, or peripheral artery disease, and how you can improve circulation to maintain healthy legs. When you feel tired or achy in your legs, especially when walking or climbing stairs, it may be more than just plain tiredness. It could be a sign of peripheral artery disease, PAD, a little-known condition that can seriously affect the health of your legs. Peripheral artery disease, PAD, is a condition that occurs when the arteries that supply blood to the legs become narrowed or blocked, mainly due to a buildup of plaque, cholesterol, and fatty substances in the artery walls. When blood cannot flow to the muscles and tissues, the legs do not receive enough oxygen and nutrients, leading to pain, fatigue, or, more seriously, a feeling of heaviness in the legs. PAD is common in people over 50, especially those with heart disease, diabetes, high blood pressure, or smoking. The main symptoms include pain, fatigue, or cramping in the legs when walking, and a reduced ability to walk long distances or climb stairs without feeling tired. Do not ignore the symptoms of PAD. While you may think it's just normal muscle fatigue when exercising, if left untreated, PAD can lead to more serious problems, including reduced mobility, chronic pain, and even the risk of amputation if the blockage is severe. PAD not only affects leg strength, but also reduces blood circulation, making you more susceptible to cardiovascular problems and increasing your risk of stroke. Peter, 65, felt his legs tired and aching every time he walked about 100 meters. Every time he climbed the stairs, he felt like there was a terrible weight pulling him down. At first he thought it was due to age and didn't worry too much. However, when the pain persisted and increased, he went to see a doctor and was diagnosed with PAD. After changing his diet, quitting smoking, and starting a supervised exercise program, his condition improved dramatically. He was able to walk more comfortably and had less pain when he moved. Many people with PAD do not recognize the early signs and ignore them. In fact, many people think that pain when walking is just a sign of fatigue or simple muscle soreness, but this can be a sign of PAD. Another mistake is not making lifestyle changes, continuing to smoke, eat unhealthy, and not exercise. Another common mistake is not treating or controlling underlying conditions, such as diabetes, high blood pressure, and high cholesterol, which increase the risk of PAD. So how can you prevent and treat PAD? Quit smoking. Smoking increases the risk of PAD because it causes the arteries to narrow more quickly. Quitting smoking is the most important step in treating and preventing PAD. Dietary changes. Eat less saturated fat, avoid foods high in cholesterol, and increase fiber-rich foods such as green vegetables, whole grains, and fatty fish containing omega-3s. This helps reduce plaque buildup in the arteries. Exercise regularly. Although walking may be painful at first, gentle exercises such as walking, swimming, or cycling will help improve blood circulation and reduce PAD symptoms. You can start with short walks and gradually increase the time as your body adapts. Maintain a healthy weight. Maintaining a healthy body weight helps reduce pressure on the arteries and improve blood circulation. Control blood pressure and cholesterol. Taking medication and checking blood pressure and cholesterol regularly will help prevent blockages in the arteries and reduce the risk of PAD. PAD can be a major cause of leg weakness and limited mobility. However, with early detection and proper treatment, you can improve the condition and maintain leg strength. It is important to pay attention to symptoms and make lifestyle changes to prevent PAD and protect your health. With the strategies we've shared, you can improve your arterial health and increase your mobility. However, PAD is just one of many factors that affect your feet. Next, let's take a look at vitamin D deficiency, an important factor that no one can ignore when it comes to maintaining foot health. Did you know that a vitamin that most of us think is only for our bones can directly affect the strength of our feet? That's right, vitamin D. If you're feeling weak in your feet, a vitamin D deficiency could be one of the unexpected culprits. Vitamin D is an essential nutrient that not only maintains bone health, but also plays an important role in maintaining muscle strength. However, as we age, our body's ability to produce vitamin D decreases, especially as we get older, and vitamin D deficiency can lead to muscle weakness, especially in the legs. When the body lacks vitamin D, muscles cannot function optimally, causing weakness, pain, and susceptibility to injury. Vitamin D deficiency also reduces balance and increases the risk of falls, especially in the elderly. Vitamin D is mainly obtained from sunlight, but as we age, the skin is no longer able to synthesize vitamin D from sunlight as well. This makes many older people susceptible to vitamin D deficiency, leading to health problems, including muscle weakness. Vitamin D is not only important for bones, but also helps muscles function properly. When vitamin D is deficient, the body cannot maintain muscle strength, Despite trying treatments, she did not see any improvement. After testing, her doctor discovered that she was severely deficient in vitamin D. She began supplementing vitamin D through diet and supplements. After a few months, she felt a significant improvement, not only in the strength of her legs, but also in her flexibility and mobility. One of the big mistakes many people make is not realizing the importance of vitamin D for muscle health, considering it only as an essential vitamin for bones. In addition, many people do not get enough vitamin D, especially if they live in areas with little sunlight or do not get regular exposure to sunlight. Furthermore, many people do not check their vitamin D levels and only realize the problem when it is too late. So how to prevent and treat vitamin D deficiency? Increase sunlight. One of the simplest ways to supplement vitamin D is to spend at least 10 to 15 minutes in the sun every day, especially in the morning. This helps the body synthesize vitamin D naturally. Add foods rich in vitamin D. Some foods such as fatty fish, salmon, mackerel, egg yolks, and fortified foods such as milk, orange juice, or cereals can help add vitamin D to your daily diet. In addition, you can take functional foods if you cannot meet the amount of vitamin D through your diet. Get your vitamin D levels checked regularly. To ensure that you have adequate vitamin D levels, get regular blood tests to check your vitamin D levels. This will help you detect deficiencies early and take corrective measures. Take vitamin D supplements. If you are not getting enough vitamin D from sunlight and food, you can supplement it through vitamin D3 capsules. Consult your doctor before taking any supplements to ensure that your vitamin D levels are appropriate for your needs. Vitamin D is not only important for bone health, but also plays a key role in maintaining your muscle strength and mobility. If you are deficient in vitamin D, you will experience weakness in your legs and problems with mobility. Make sure you get enough vitamin D to keep your legs healthy and active, especially as you enter your golden years. With adequate vitamin D intake, you can keep your legs healthy and functional. However, vitamin D deficiency is just one of many factors that affect the health of your legs. Next, let's learn about a sedentary lifestyle and how to maintain flexibility and strength as we age. Did you know that the less active your legs are, the weaker they become? If you spend most of your time sitting or lying in bed, you may be weakening your legs without even realizing it. A sedentary lifestyle is not only harmful to your overall health, but also reduces the mobility and strength of your legs. A sedentary lifestyle, especially in the elderly, is one of the main causes of muscle weakness, especially in the leg muscles. When we sit for long periods of time or are inactive, our muscles weaken due to lack of activity, making it difficult to maintain flexibility, strength, and balance. Studies have shown that sitting for long periods of time or being inactive can reduce blood circulation, leading to weakness in muscles and soft tissues. The cardiovascular system also becomes less efficient, which means the body does not have enough energy to maintain basic functions such as walking and standing. A sedentary lifestyle not only affects leg strength but also increases the risk of chronic diseases such as diabetes, heart disease, and high blood pressure. Weakened leg muscles increase the risk of falls, reduce the ability to maintain independence in daily activities, and seriously affect quality of life. It is important to realize that we can change this. By engaging in daily physical activity, your legs can become stronger and help you maintain independence for years to come. Richard, 75, is a prime example of how a sedentary lifestyle can affect leg strength. He worked in an office job for over 40 years, and when he retired, he became less active. Initially, he didn't feel anything special, but after a few months, he began to feel pain and fatigue in his legs whenever he stood or walked for long periods of time. After participating in a gentle exercise program, combining walking and yoga, he felt a marked improvement in his health. He could walk further, stand for longer periods of time without feeling tired, and most importantly, he felt more confident and independent in his daily life. A common mistake is to think that exercise is only necessary when there is enough time, or that it only requires participating in rigorous exercise programs. In fact, long periods of inactivity can have a serious impact on muscle strength.
Even small changes, like getting up and walking for a few minutes every hour, can help improve leg health. In addition, many people think that exercise is only for young people, and age can be a barrier to starting a new exercise regimen. However, maintaining an active lifestyle even as you age is extremely important to keep your legs healthy. So how can you change your sedentary lifestyle and maintain leg strength? Start small. If you are new to exercise, start with simple steps like walking for 10 minutes a day, then gradually increase the time and intensity. You can walk around the neighborhood or even walk indoors if you can't go outside.
Engage in gentle exercise. Exercises such as yoga, tai chi, swimming, or cycling are great options for seniors, helping to maintain flexibility, strengthen muscles, and improve balance without putting too much pressure on joints. Make exercise a regular habit. Try to do exercise for at least 30 minutes a day. You can break your exercise time into 10-15-minute segments if you don't have enough time for a long session. Incorporate into daily activities. Take advantage of opportunities in your daily life to move, such as walking instead of driving, standing up and walking while watching TV or working from home. A sedentary lifestyle not only affects the strength of your legs, but also weakens your entire body, making us more susceptible to health problems. However, by changing your habits and exercising regularly, you can maintain leg strength and continue to live independently and healthily into your older years. As we have seen, maintaining strength and flexibility in your feet is extremely important as we enter our golden years. By making lifestyle changes, maintaining regular exercise, and taking proper care of your health, you can improve your foot health and continue to live an independent, healthy life. If you find the information in this video useful, don't forget to subscribe to the channel so you don't miss out on other useful healthcare videos. Share the video with your loved ones, and together we can maintain good health every day. Thank you for watching, and see you in the next videos.